Welcome to Eye Contact. I'm Richard Packard, and today we're talking to Zoltan Nagy about femtosecond laser cataract surgery. So welcome, Zoltan. It's now over 10 years since you first used femtosecond laser assisted cataract surgery. What is the current status of FLACS? Do you know how many surgeons now use the femtosecond laser regularly in their cataract surgery? And really, what are they using it for?
I think it has been quite a nice and long journey during this past 10 years. I think thousands of surgeons are using worldwide the technology, and quite a number of companies are producing this laser, and I think it's still evolving, this technology. We hear numbers in the literature that 2-3 million of eyes have been already treated by this technology. The first users were, of course, in the private clinics of ophthalmology, and now it appears that also in state hospitals appeared the technology. The problem is still the price of this technology, and I think it's still evolving. Now we hear in the literature about new usage that with this technology, the intraocular lens can be transformed from monofocal to multifocal.
We'll talk a bit more about that.
Okay, thank you. Also, the technology was first used for corneal surgery, then cataract surgery, then cataract refractive surgery, and also the technology is possible to use for glaucoma surgery. I think this is might be a surprise in the future, and hopefully it will come true.
So, laser capsulotomy, this is a new subject. I mean, how has it evolved over recent years, and how have you overcome some of the issues with tags and the capsule tears that we've heard about in the literature?
I think it was debated in the literature because when we first used this technology, then of course the cut line was not so even as with the manual capsulotomy. Substantial research were made on this field, and it came out that when we lower the energy of the femtosecond laser, then we get a more even line of capsulotomy. It was also debated that whether this capsulotomy is stronger or weaker than the manual capsulotomies. According to our research, we found out that the tear force is somewhat lower, but only somewhat lower than with the manual capsulotomies. And if we create the capsulotomy with a lower energy, then the resistance and the force against the capsular tear is very similar to manual capsulotomies. So I think with the research was done until now, it's very similar than to manual capsulotomies. And now there are other technologies appeared also in the market, which is not so expensive as the femtosecond laser capsulotomy. I think this is an important message for the industry that either they should lower the price of the equipment and also the one usable equipment, so the patient interface should go down in pricing, because I think there's a high competition on this field with other companies.
Interesting. Now, I mean, what other aspects of cataract surgery do you think that this is important? And what advantages do the femto laser have as far as the rest of the procedure is concerned, maybe the scissions or breaking up the nucleus or something like this?
I think the fragmentation of the nucleus is a very big advantage, because we can spare phaco energy by this way that the pre-cut line within the nucleus, I think, can spare, and also the liquefying of the central part of the nucleus can spare substantial energy. This is very important in eyes where diabetes, where endothelial cell count is lower, where previous uveitis attacked the eye, or where are some injuries before, or loose zonules, or white tumescent cataract, so, or pediatric cataract. So many advantages in many cases. And also the corneal wound, I think, another important issue, and the arcuate incision to control the preoperative corneal astigmatism. I think it's a great advantage and can be used very usefully in during this laser technology. I think the most important part is capsulotomy. The second, I would rate the fragmentation of the nucleus. The third, I would rate the corneal wound and also the preoperative corneal astigmatism. So there are 4 steps what surgeons can use and may take the advantage. And I think they should use also in this order the possibility of the femtosecond laser. All needs a learning curve, which is not very long, but I think all surgeons who start with this technology should know about this, that this is a different technology than the manual capsulotomy, and should learn very well all aspects of their femtosecond laser.
In relation to the nuclear fragmentation, some of the patterns result in very small cubes. Have you found problems with chips being left under the iris?
Yes, I think this is dangerous. It might stay behind the iris unnoticeful, and then it may create some inflammation after surgery. I don't like very much these techniques. I like much more the liquefaction of the central nucleus if it's not a very advanced cataract, and I like much more the incisions. It can be a cross pattern incision, it can be a pizza pattern incision or whatsoever, but it should be clear incisions within the lens. Small cubicles, I think it needed a very dilated pupil and a very experienced surgeon.
You've mentioned price already, and certainly there have been a number of studies, first of all, that have shown that there's not much difference in terms of outcome, but also looking at the potential cost-benefit ratio. Do you think there's any data out there which indicates that there is a price benefit because of the way the procedure actually works?
I think only high-volume surgeon might have a financial advantage of that, and also for surgeons who are using premium lenses. I think by using the premium lenses, then it's very important to have a very precise size of capsulotomy. The anterior capsule should cover the optical surface of the lens by 0.25 or 0.5 millimeter. Then it provides a very good centralization of the intraocular lens, and also the all benefit what the lens can be offered, especially with the multifocal lenses. I think multifocal lenses have a great attention from the public, more and more people interested in that, and also they want perfect surgery. What femtosecond laser technology might offer, that it doesn't depend some critical steps of the procedure on the fatigue of the surgeon. So I think the capsulotomy can be very centralized, can be guaranteed diameter, and can be also guaranteed that the intraocular lens will be covered by the anterior capsule. I think the technology is not different from previous phacoemulsification technology, and we cannot expect so much difference in results as we experienced when we shifted from extracapsular cataract technology to phacoemulsification. This is the same procedure, but 3 or 4 steps taken over by the femtosecond laser, which can be critical for the success of the procedure. But this technology is not, instead of good surgeons, this is helping good surgeons. So you need a good dexterity and a good experience with the manual phacoemulsification before starting femtosecond laser technology.
Just before we close, you mentioned earlier on about a new technology, a new way of using the technology in relation to intraocular lenses. Would you just like to say something briefly about that?
I think this is very important and very new, that you can transform a monofocal lens to a multifocal form of lens. So to provide patients with good near and long vision, I think this is very, very important without touching the eye. And also you can transform back a multifocal lens to a monofocal lens. Some patients are unhappy with the glare phenomenon if their pupil is dilated larger in dark situation than a normal pupil. And some patients want a multifocal technology. I think this is very interesting and a very important use. And last year, I've seen the first reports in the literature about this. And I think this is a constantly evolving or developing technology which might be of great importance in the future. also the other aspects which I mentioned can be for the future application of femtosecond laser technology very important.
Thank you very much, Zoltan.
Thank you very much.
For more information on this and related topics, visit us at eurotimes.org.